Well, they're a live animal that have been designated an approved medicinal device, and they've been used in medicine for thousands of years. Brianna Silvassi explains.
Leeches like these have been used in medicine as far back as 2,500 years ago, and they're still being used today. These leeches were used recently during a surgery on a Levittown man to reattach his ear.
Primary purpose of this particular leech, it feeds on blood. And so you put it onto the congested portion of the body, whether in this circumstance it's the ear, and by the act of feeding, they relieve the venous congestion. Therefore, oxygenated and nutrient-rich blood can continue to come into the ear.
76-year-old Richard Belsky recently fell on some ice, partially amputating his right ear. Doctors here at Nassau University Medical Center say they use hyperbaric treatment during reconstructive surgery to control swelling, and then use the leeches to suck out the excess blood, with the leeches temporarily acting as the blood vessels that were cut during amputation.
We do use it with some frequency, and in this circumstance, it happened to be the perfect choice and worked out perfectly.
According to doctors, there's another type of operation that could have been used in Mr. Belsky's case, but due to the amount of time it takes, they said it was a little too risky. At age 76, they said this combination of treatments was the most safest and efficient.
Because if the ear doesn't survive, as mentioned in this individual's case, he wears a hearing aid. If you don't have the contour of the ear, the hearing aid has nothing to sit into. He also wears glasses, such as myself. If you don't have an ear for the post of the glass to sit on, it's very difficult to keep glasses on your face. So, from a very practical perspective, keeping the ear is very important.
And while Belsky says he's been advised not to discuss just how his ear was amputated when he fell, he says the surgery to reattach it appears to have worked.
I went down for the first time to the bowling alley, and people were coming up and looking at me and saying, "Which ear was it?" And I said, "My God, that's unbelievable."
In East Meadow, Brianna Silvassi, LI News Tonight.